Our next speaker is Quentin Vanhaelen from the greatest supporters, co-organizers of the conference. So happy that you're here, Quentin. Looking forward to your amazing talk.
Thank you. So, thank you for having me, and good afternoon, everyone. So, on the behalf of Insilico Medicine, my talk will be about the recent development the company has made into a new platform, AI-based integrated platform, specially designed to identify new targets. So in this case, I will talk more specifically some example of what can be done in the field to identify, target for age-related disease. So to put things into context, what we all know about aging is that it's kind of a relatively highly complex process that's basically unfolds in very different way. And the main reason for that is also because human bodies as the dynamical system is itself highly complex. But what we have learned, in the last decades, not only in biology, but in physics and other fields, is that with complexity usually comes hierarchy, structure, and kind of order. And when we can take this into account, what will not necessarily make sense when considering every single piece separately actually can actually be better understood when you can get the bigger picture. And, in the last decades, there have been a dramatic increase, in the ability to analyze, measure everything that happens within a living system. Many in this great audience has contributed to this. So the main question, how you can actually leverage with new knowledge, not only separately, but into a kind of integrated pipeline to actually come up with a better understanding of what aging truly is and how you can actually address it. And with the development of all those, omics technology and better understanding of the human body as a very complex system, there have been the development of complex systems approach to aging. And recently there have been a very nice review published by Alan Cohen from Sherbrooke with his team in Nature Aging that just emphasizes the need to move from an approach where basically one will focus on one specific pathway, one specific target, which might be great, working great in a very relatively restricted area, toward a more systemic view and understand better how basically this target, this specific pathway is, interacting with many other actor pathway or other components of the human body, for instance, and understand that a target that might be very highly suitable to, for example, address a specific disease, when considering that this target will be very likely to be involved in many other functionalities, well, maybe actually one needs to be more careful how you actually deal with this target in particular. Also, it has been very, very well known for some time that we have a lot of, aging characterized by many different features that also interact all together, okay? And also, it's important to take into account that they will interact and influence each other. So you have this actually feedback between what we will call the canonical aging mechanism and actually what is supposed to be the main driver of it. So it's also something it's important to take into account when trying to address aging or the age-related disease which has been identified so far. And so what we all know at this stage at the conference, I know we have a lot of great talk about this in particular, is that aging can be characterized when we are looking at different specific mechanism called half marker aging. And even at this level, we understand better that those hallmarks are not necessarily all equal. So you have what we will known as being the primary causes of aging, than basically what they call the antagonistic hallmark that actually will be caused by the body responses to the damage themselves, And then, again, integrative macrophaging, that will be essentially the result coming from the cumulative action of the two other type of macrophaging. So, knowing this, basically the main question, how you can try to better understand the interplay between those different mechanisms, knowing all the amount of data which has been assembled, generated over time, and with the dramatic increase in computational power and AI or machine learning technology we have seen during the last few years, actually, or maybe. And so to apply this to a specific problem, well, we know that the disparate damages we have are usually associated with what we call age-related disease or age-associated disease. So, and themselves usually can be related to some specific genes that might see changes in the expression of our age. So we will call them age-related genes, for instance. And so the idea is how basically we can identify new target by essentially focusing our attention on targets that are actually associated not only to some mechanism of aging or macrophaging, but also to age-associated diseases itself. And so to increase the probability that those targets might be more actually active and effective. Now, when it comes to solving, the problem with the disease, is that usually it can be very complicated to identify targets for various reasons, and we know that many actually program will actually fail later, essentially because of the activity is not as good as expected, or there is a lot of complication due to toxicity and side effects. So how we can actually address this problem is that we try to leverage basically all the biological knowledge we have, not only taken separately from each other, but by combining them into a single framework that will kind of provide a multidimensional view of what the human body is and how basically aging or the associated disease we are mostly interested in actually can unfold and propagate into this system. And not only we consider all the omics data, the text data that also give you an information, but also we are asking the question, when you have a target, you need to find a compound against this target, so what are basically the probability? So the durability of this target from the perspective of the accessibility, the safety and possible side effect, and what type actually of compound might be suitable for this target, and all this into one single framework. So that's basically what Insilico Medicine has been working for already sometimes, and we come up with this type of framework that basically combine all the platform required to perform omics data analysis, to understand actually not only the list of genes and how they interact dynamically with each other within those different pathways that might be relevant with respect to the problem or the disease and direction, and then moving forward when basically we have a better understanding of the mode of mechanism of action, or basically which target will be more suitable when asking the question of, durability, safety, another critical question that must be addressed in this process. Over time, in order to validate this approach, we have been publishing a lot of articles whose aim was to validate the different type of component we have progressively added into the platform, from pathway analysis, omics data analysis and adding progressively different features based on machine learning or artificial intelligence for feature selection, target identification, and so on over time. And for example, and usually not specifically on aging, but also different type of diseases associated to aging, cancer, for instance. Not focusing on one type of omic data, but see how basically combining different type of omic data might be actually beneficial towards identification of more better target. So one example of what can be done is that if we know basically we have list of age-associated diseases, we know type of non-associated diseases as well, so we can try to essentially identify basically genes which show a significant differential expression when in the case of age-associated disease. And then among those one, we can go a bit further and try to identify which one actually are associated with the different hallmark of aging as well, right? So basically, you have targets that actually have a dual purpose. They can not only be interesting for a specific disease, which is known to be, encountered as people age, but also can also be interesting to address a specific mechanism, even at an early age, for instance, when you want to prevent or slow down aging, for instance. So basically the idea is also to try to understand when you have a target. You have targets that are relatively well known and others that are less well known. So what are the novelty? Of course, when you have a target which is already well known, the mechanism of action are better. You may have a huge amount of information of compounds already tested against this target. Now, basically, the idea behind this tool is that we also want to try to go a bit further and identify completely novel targets. So they might be more challenging to address. You might take more risk in actually focusing on those targets, but they actually might lead to interesting discovery when trying to address some type of disease. And so in that case, we have an article recently published where basically they were able to identify a few 100 targets using actually this idea of combining age-related diseases with the hallmark themselves. And so, for example, here there is a list of age-related diseases that were taken into account with actually 4 different classes, and we can see basically what genes actually, depending on the level of novelty of those targets, what gene is associated with what type of age-associated disease class, for example. And so generally we are also interested in basically understanding what are the possibilities to actually find a drug for this target. So there is this idea of combining all the omics information coming from the omics data, so the mode of action, the novelty of the drug with respect, for example, is there any other already available clinical trials, targeting this one in particular, and also what are the, how easy it is to basically find a drug or compounds toward this target as well, and this basically for each hallmark of aging taken separately, so that you have this this type of that basically summarize essentially how they position themselves. And in addition, because we have this huge amount of information about pathways, so all those genes and targets which are essentially themselves integrated into usually more than one pathway, or basically this target is interacting with other molecule, and basically that's also quite very useful when we try to identify and understand what would be the possible side effect, which is one of the major concerns when you try to bring a target into later stage or even in clinical trial, is that basically the safety or toxicity might actually appear to be more elevated than anticipated. So understanding in a bit bigger context what this target actually does is also very important at a very early stage of the process. And so to go even further, to reduce even the list of targets, we can also take into account additional mechanism. So we have a filter which is integrated into the platform that allow you really to narrow down basically the list of targets. So not handling with like hundreds of targets, but with a few dozen, which are not only very relevant from the perspective of the disease you are interested in, but also from the perspective of further clinical development you probably are also interested. And so this is essentially the final list of targets. So basically you see that there are actually the protein family, what type of hallmark of aging they are associated to, and you can see how they are actually kind of dysregulated with respect to some age-associated disease. What is interesting is that many actually happens to be dysregulated for all diseases considered in that study. And you see even the four last one. So fibrosis, we have been told many times during this conference that fibrosis is aging. So you can say that basically all these targets might be actually perfectly relevant target with respect to fibrotic disease as well. And the last is just to illustrate that we have also investigated, so the problem of toxicity, is there any evidence that targeting this target might lead to basically severe toxicity. So in that case, it seems that those targets are quite promising. So I invite you to read the article where you have actually a quite comprehensive description of those targets. And so thank you for your attention.
Thank you so much, Quentin. That was really fantastic. Questions for Quentin?
Not too much.
So as so you guys are focusing on specific diagnosis, of course, and this I guess is for to be able to actually make some money out of your. But if you want to transition from there to aging, what are your thoughts?
Well, basically we have, aging has always been a kind of a main interest in the company from the early beginning. So we have actually 3 dozens of programs we are developing, and many actually focus on age-related diseases. The most common is obviously cancer. We have different programs in different stages of development for cancer. And I think in the near future we might see a very promising result, hopefully, for those programs.
All right, yeah, super exciting.
Yes.
Yeah, a lot of your targets related to sensing extracellular matrix stiffness.
Yes.
Is that correct? Could
you
comment
indeed
on that?
Yes, so we have several targets that are associated to extracellular matrix because, well, recently it has been shown that this mechanism in particular might actually play a bigger role than anticipated into the aging process itself. So yes, we have developed a specific interest to that, yes.
Thank you very much. During this meeting, we heard about different companies and different research groups using a variety of AI systems. Are these systems comparable? Do they use the same input data? So how can we kind of relate to all these different systems?
So, well, you have maybe things in common and things different. In our case, what we try to, what I think distinguishes ourselves for other companies is that we have actually, and this is a summary on the slide, we try to develop, actually we are doing this, a pipeline that combines all the steps of early stage of drug discovery. So I presented today what the company has achieved in the context of drug target identification, but in addition we have a complete separate operational pipeline focused on generative chemistry. So the aim of this is once you have your target, which might be a difficult target or a novel target, we have actually the tools needed to actually generate a molecular structure that might actually be suitable for this target as well. So even if the target itself, you don't know in advance any already known compounds that might happen, well, we can actually design the compound that is suitable for this target. And in the near future, we have also, but in the development platform that might also help to predict the clinical trial outcomes as well.
I have a question in terms of, you could say, have you cross-validated against what you have for aging and Ingenuity or Metacore, these knowledge bases that have been in creation for about 20 years these days?
Yeah, so I think I did not mention explicitly, but so this study, for instance, for the age-related disease, and we have found that many of the targets we have identified in this work in particular are already listed in the, for example, GenAge databank, which is a curated database containing I think 300 of genes that are known to be directly associated with the age process. We have also cross-validated those results with the Geroprotector database, which also contain genes. And the platform itself also contains other databases that help us to understand that, well, we have novelty, and those targets are also already listed in different contexts as well, yes.
Hey, that was an amazing presentation. I think the question I had is kind of almost a follow-up to the last question in a way. There are a lot of platforms out there, AI platforms that claim to do target discovery, drug discovery in general. And a lot of them are in the longevity space itself. What is really the differentiator? I think you allude to some of those points, but I would like 1, 2, 3. These are the 3 differentiators for you, if that you could.
Well, I think the first one I said, so this type of really toward building a complete integrated and independent platform, that's the first point which differentiate this company from many others. And the second one, if we focus on generative chemistries, we are not only interested in trying to identify a molecular structure that are already known, so just slightly modifying a given structure, but we have the capabilities of truly, investigating the chemical space and coming with structure that will not be possible to generate with more classical techniques. And I think the last thing is that even if the company was, I think we had a talk earlier this week on the computational aspect, we're also truly interested in developing, all the tools so we can take the target on the compound into all the future development, so clinical, clear phase 1, phase 2. So we really want to take this and come with a drug and a treatment, actually. So that's basically what I would say.
Actually, just to add to this question, well, first of all, which other target ID platforms that you know that are out there, AI platforms, like, can you name 1 or 2? Which one? And that platform is openly available for others to license and identify targets.
Yeah.
And how many models does it integrate?
By models, you mean like disease models?
How many AI models are integrated into this platform?
I won't know at the top of my head.
Okay, so now another one. How many pharma companies are using it at this point in time?
A couple.
A couple. And are there any validated targets that went? Yeah.
I'm not questioning the validity of Insilico, by the way. I'm genuinely curious.
Yeah. The reason I'm asking these questions is because there is actually only 3 platforms out there that are considered to be leading. So at this point in time, for PandaOmics, it's the most ubiquitous. So many pharma companies are using it. Currently, it's like 280 users. So the more they use, the more philosophies we integrate. So currently, it's about 60 target discovery philosophies integrated in there. So 12 AI models just for the omics. It is 7 AI models for text. And then 3 AI models for identifying the credibility of the KOLs who prepared the original studies. So, and also we've got about maybe 40 annotators that annotate the data constantly. So the data is also very, very clean.
Thank you.
Thank you so much. Really fantastic technology. Amazing. Alex?